Hello for everyone. My name is Dinara Yessimova. I am from Kazakhstan. I'm also a member of the team, Professor Stover, how the project, the Solid project, and I would like to present quite overview of the research which we did recently in February and March in the direction of the needs and families with children and children and families living with HIV, which was done in the several regions of Kazakhstan. And I would like to share with you quite results and funding of that. And I am representative also as a national university, which located in Astana in Kazakhstan, and I got my PhD in social work, and I'm teaching social work last 20 years, and also last 6 years I am external advisor of local UNICEF Kazakhstan fund. And in terms of that, they invite Ministry of Labor and Social Defense and UNICEF. They invite me to be head of the social work assessment team, and I would like to share some fundings which we got from this work. And UNICEF UNICEF Kazakhstan last year is working in the direction of the standards of psychological support, which my colleague Nadar Karimov, he also provided a presentation about with highlighting these standards. And they work very close to children's and the families. UNICEF Fund also 5 years ago taught us as a trainer in the patronage nurse system to home visiting. And here also, like we are doing a further work with the child and the families with HIV. And because it's a very important last year and increasing numbers of people with HIV and the child with HIV, it's Ministry of Social Defense also put on the focus these problems, issues, and then it started the project between Ministry of Social Defense and UNICEF. And the end of that, expecting revising some laws, which also in direction of social work, and hope it will be possible to do some critical review and critical revision law in social work. And I would like to say also about the goals and objectives of this external assessment, because it was several teams. One of teams was colleagues from the National Republican Aid Center, people from the epidemiological infection background. Another team was from the pediatricians, and one of team was team on the social work assessment. And the goal was to map needs of families and children living with HIV and our chronic diseases, and also to see how works a standard which last year was probably provided of UNICEF to Republican Aid Center to be involved in the everyday routine of Aid Center. And it was chosen some locations, 6 locations, East Kazakhstan, including Uсть-Kamennogorsk and Semey, then Shymkent, Turkestan region, Almaty, and Taldykurgan cities. Also have chosen Karaganda and Timurtau region, but due to COVID, this assessment is postponed to possible time. some little bit later, we are still planning to do so. And what was the object? Object was to analyze the application of need assessment tool and also to conduct external assessment to family and child support based on the HIV support standards, and then also to support multi team from a center who assist in people's and families, children with HIV. Also, one like challenge is for us was to elaborate action plan for the local municipalities, for cities, also for a center in the question of development of social work. In direction of the HIV and to work as HIV. And even also for me as a head of this assessment group was challenged to seek social worker in aid center. And how we will see in future social work needs to be in aid center or somewhere needs to be a social worker who could provide a social assistance for family and child with HIV. And nowadays, most of the work doing by local NGOs who supported even aid centers who supported family and vulnerable groups with who has some addiction or HIV or drug addiction, etc. And for this reason, I invited to also to share the experience and highlight the current work and situation in Kazakhstan. My colleague from NGO, from Alexander Pak from Pavlodar, the Public Fund Revanche from Almaty, then Sholpan Primbetova from Columbia Center Global Health from Almaty, also to highlight situation. But if we are talking about institutional social work, it's still the challenge, and we like nearest time we need to solve from where will be strong support, even using technology of social work and case management for the child and the family. And what I also would like to say, methodology of this external assessment was a selection of the 15-20 families with children living with HIV in selected areas, and children living in the boarding schools or orphan houses. How it's because child with HIV have very high risk to be orphan, very early ages, because it's related to the health of their parents. And we try to do some focus group in these areas, sometimes meeting with the families in NGO, how we did in the Uсть-Kamennogorsk and Chimkent also, because how in Chimkent there is a very biggest population of children with HIV. And we did also triangulation, 3 data collection methods, direct observation in aid center, and analysis of content analysis of documentation, which holding social worker in aid center and other social workers in NGO and another in polyclinics even, and interview and focus group with a target group of families with children. In some regions, we also did a patronage to the home. In one case, we did home visiting to one girl. She lived in rural area in East Kazakhstan, and we tried to collect a team, multi-team from the local polyclinic around her. Why from polyclinic? Because her village very far from the city, and the peoples from aid center, they couldn't come to her very very often, and what they doing. The team pediatricians for her coming and providing to her like pills, alluvia, but for example, Liz's family needs also social support and the work around Liz case. What it means that some people's being in the deprivation and also waiting some support, social assistance from social worker, but from where social worker, from aid center, from NGO, or from the polyclinics, we need to define and probably solve coming years, also nearest time. And then what kind of team was, and a team of external assessment in social work direction consists from me, Yessimova Dinara, head of this team, then Aupakirova Yagos, she was my assistant. We are working together in Department at Eurasian University, then Larisa Tikhonova from local UNICEF office, and then two of my MA students in social work direction from Eurasian National University, to also to get experience from the field, and then to be helpful for people, and probably further to have a specialization probably in social work with HIV, because as mentioned Professor Stover, we also need to not to provide a bachelor degree, but also to provide a 1 year special courses or to special MA in the addiction and work with this kind of special direction of social work, and we need to think about that. Then we did directly interview with the head of the 8 centers, in 6 locations, 6 cities, and I would say that the picture is quite different in different regions, how they're doing work, even active work on. Not every aid center has a social work in the team. Just two from 6 aid center has a stable social worker in the team, but even despite on that, mostly social workers they have a medical background, but how we all know that social work needs to be have a bachelor in social work as minimal standards to work with clients. And as I mentioned, the next cities: Shymkent, Turkestan, Almaty, Taldykurgan, Semey, Uсть-Kamennogorsk, Karaganda, Temurtau. We need to go a little bit later, and because the visit to Karaganda, Temurtau didn't happen due to national lockdown with COVID situation. And what we did also in this field work, we summarize some barriers to access to the system. Case with a girl from the East region show us also how to do elaborate action plan with kind of steps. And we provide a big report to Ministry of Social Defense. It's a very big report. It's more than 1,000 pages, and we provide also short briefing after the field work in every city on the level of the healthcare department in each city. And a recommendation of the result of the study, we also elaborate to directly to aid centers, also Republican aid centers, then directly for NGO also, and then to Ministry of Social Defense on the national level and the level of the National Alliance of Social Workers, because we have seen the gaps where we also could provide as a assistance for the development of social work in this kind of direction. Um, Location, I mentioned here location, and it was like 3 points, 8 centers, primary health polyclinics, including rural place also, because in rural place there is no access to NGO 8 centers, and NGO also, it means that mostly family just have access to primary health care, and that's all. And it means that we need to think about how primary health could assist families with addictions and with chronic disease, with HIV also, especially especially women and pregnant women, because in our country just we have 6 social groups who need to provide the test, like obligatory test, but and pregnant women also have a chance probably to explore the HIV status during pregnancy, but when she opened up that she has a HIV status, that it doesn't mean that she will be object of social work. Mostly cases is assisted by local NGOs. But if we're talking about rural place, no one could support pregnant woman in just in the, but in some cases, if the status is open, the assistance could provide local polyclinics. And some NGO, also we visited NGO in Almaty, in NGO located even in the 8 centers building, and they work very close. And NGO workers, they are also working like outreach workers in the 8 centers, but they haven't a status of social worker, and it's also a dilemma. And we visited to NGO in Shymkent cities, which is very big and have a long story in work as HIV. And we visited in NGO in Uсть-Каменогорsk also. And in Taldy-Kurgan, we visited NGO with working is MSM. And then most of in Uсть-Каменогорsk, we visited the Answer NGO, who is working with addiction. They covered several directions of social work, but it's mostly in NGO working not pure social work again with a background. It how the like career of the social worker in NGO, they started to be from the volunteers and to be outreach worker, then to be on the position of social worker, but without the background of social worker. And it's reason why we also could help them from the national level to raise capacity to work with addictive people and addiction. And some NGO also said that there is a lot of them like coming back again to addiction, even someone works very nice and closely. It's mean probably that we need to provide more deep courses and more long time education or inoculation of the training, probably provide 1 year training for the social worker who work in NGO. And as a conclusion, what we could say is that it's that mostly services which is providing to families with addiction, with people with addiction, child with HIV, mostly providing from NGO, and government also tried to cover, to provide the grants for the NGO, even Ministry of Labor, Social Defense, they provide like significant money to cover some services, but we need still to be like enhance and make a stronger social work as a professional role, and the social worker needs to play also significant role in NGO. How we have seen in Germany last year, where in NGO mostly worked very educational people with social work background, and to provide even from NGO very qualified assistance. And as a equal counseling in NGO, like playing like significant role in helping families with children with the I was, as probably mentioned, our colleague from the Energizer NGO from Almaty. We also visited them in Almaty, and last time we were trying to provide them to supervision session, to work with the very hard cases, to provide them the steps of the case management, and to, as a national alliance, I am also as the head of National Alliance of Professional Social Workers in Kazakhstan. We are put in our plan to support also NGO to learn together, to assist every cases by case management steps. And what also funding and next steps we need to not enhanced, probably to make much more stronger education and social work. And it's a still issue. Government provide a very low number of educational grant from government to social work education, and I do hope that with this solid project, we could elaborate and to enhance our education and social work, and open special direction in social work, working with addiction, because it's very big problem to current Kazakhstan to work with addiction, to provide assistance. And we provide a recommendation to national level to a revision of the needs of a social worker as a specialist, and increase the number of educational grant. And we're working closely last summer, I would say, with Minister of Education, and hope next year we will get more educational grant and could probably make more familiar our society with social worker as a professional, a significant action and driver in our society. Hope so. And revision, a critical review law. We have a general law in the direction of social work, which is called Special Social Services, and Kazakhstan adopt this law from the more than 11 years ago, and now it should be revising with the modern challenges. And because, for example, we haven't explanation terminology of social work in Kazakhstan as we have from the National Federation of Social Workers, because in our law it's just that heavy social situation, that's all. But how we could indicate what is a heavy social situation is still open questions. And also our recommendation is involve the concept of management, higher risk supervision, in-depth assessment, intervention, individual family development plan, etc. Form professional approach in area of healthcare and penitentiary system and probation system in education institutes, to use them in everyday routine, because now we're using them, but we haven't this terminology in our law, and it's contradiction. And also consolidate or approach to work with client needs rather than the declarative one, because before it was more declarative act to say that I am an object of social work, let's work with me. Now we are working, and also last years with the local UNICEF in the patronage nurse visiting uh, model, where we could go from the patronage home visitor from local polyclinic, then identify family in risk, even probably with parents has some addiction, etc., and that we could choose them to provide in-depth assessment, then to elaborate individual working plans, then to support this kind of family. And we elaborate also action plan for the NGO to provide them some support in knowledge, in special knowledge in social work, and also to provide in case management trainings for them. Because as shown is in our research last year, they know what is, for example, in-depth review, they know what is the individual plan, but sometimes it's mixy, and probably they need support and know how to probably work and to get more sustainable results of work. And hope that if you have a question, you could send me a mail, and hope that I could try to highlight a last activity what we're doing now. At the same time, because I'm representative of several directions of social work, I hope that we could enhance, first of all, education social work, then to try to support several sectors to get knowledge, to get information, and support by the best way our families and children.